One second. I'll be asking questions anyway.
Okay. Okay.
Hi guys, welcome to Doc Tutorials interview session, and now we have our AR rank 3 candidate here for a very sweet chat. We are happy having her here, and this is about how she get into medical oncology. How did she prepare? What does she wants to tell the future aspirants as well? Hi, how
Hi,
are
sir.
you, and how is your day?
Yes, sir. It is very good, sir. Actually, very happy, sir.
So much of
Mm,
dreams, so much of hard
mm,
work, and
mm.
so much of expectations, and everything comes to a single point, and you get a huge result, and then your night is all boomed with all congratulations, messages, so much happiness, and going forward, I think this will stay on. Now that you have changed from the mode of student to a faculty, probably in another few years. So this is going to be a very smooth journey for you. Just that entry is going to be a really difficult part. Once you have entered, it is all that you want to gain experience from medical oncology residency and then kind of start practicing. So no more that you're going to find it difficult in any part of your life. Even your exit exam is not going to be difficult. Most of the centers are going to make you work and see how you work, how you are compassionate towards the patient, and then decide whether you pass or not. And during that sequence of your 3 years, you will obviously learn a lot. And the most important thing is the first compassion towards the patients, and that is the denominator for any medical oncologist. So going forward, let you introduce yourself, your name, your MBBS, MD, where did you come from?
Mm. Okay, so myself, Dr. Sudheeshna Araviti. I did my MBBS from Ongole, Rajiv Gandhi Institute of Medical Sciences, and I passed out in 2020, and then I joined in the MD Radiation Oncology in GGH Guntur in NATCO Cancer Center. I passed out 1 year back, and I taken this branch because so many people said it is different from other branches, like not
Obvious.
completely. It is developing day by day and related to technical department. So okay, somewhat different from other branches, and there is also both contact with patients, and like I felt like both software and doctor mixing. In office, I felt meeting with the patients, and when come to TPS and contouring all like the before system, I felt like some software. So mixture of both these, and I love that branch very much, sir. Uh,
So
that's it.
now you're a wholesome oncologist. So you will be
Uh,
able to handle the patient top to bottom as to whatever they need. And in terms of radiation, you will be able to do the required things for the patient. So it is kind of making your life wholesome into oncology.
yes.
So you're totally into the field of oncology now. So going forward, our advice from our end also would be, apart from being compassionate, stick to all your guidelines, stick to all your, I mean, kind of theoretical part as well, just not practicing what we are gut feeling is. As and when the guidelines change, your science changes, you'll be able to understand how you are supposed to approach your patient as well. And is this because you just did a radiation oncology, you want to do medical oncology, or you are really damn sure about medical oncology at all?
No, sir. When I'm in radiation oncology, uh, we will go to peripheral postings in medical oncology. Then I felt it was good. More patient interactions. We have to treat side effects, everything. We have to take care of patients from beginning to the end, and so many things like cosmetic, the side effects, nutrition, everything we have to take care, and
Ex-
so much
ex-
interaction with patients.
Exactly. The right
Mm,
point brought out. It is going to be a wholesome branch. It is not just giving chemotherapy. That is what is expected out of an oncologist as well. We are not chemotherapist. We are supposed to manage the patient in terms of the theoretical part, molecular part as well, taking care of the side effects of your treatment, also kind of supporting them in all other aspects like your speech therapy, physiotherapy, your nutrition, everything needs to be brought out of you and your team. And that is how the whole holistic management of the patient is also going to be. And when did you start your preparation?
I started it before 1 year, exactly 1 year back, sir, after previous NEET exam. Actually, I'm not sure to get into because I can't remember that much chemotherapy, drugs, and side effects. But when I started reading, it was very good. I I don't know how much time I'm reading. That's very good subject actually. If we know the basics, it is very easy to get all these names or all these side effects very easy to get. Actually, initially, I can't. I think it is very difficult for me to remember all these drugs. Initially, for mechanism of action, also, for me it is very difficult which class of drug it belongs to. But the later, when I start reading, it was very good. Very good subject.
And
Medical oncology is a very good subject.
so, how did Dr.
And
Tutorials come into the picture, and when did you
my
start
say
subscribing?
My senior suggested me doc tutorials. She said it was simple but very relevant to exam, and it is sufficient. No more other things are required other than this. So I strongly believe in her. So I took doc tutorials, and I
So
started
you
preparing since 1 year.
So 1 year of preparation, you are convinced that it is enough, and that you have proven as well. For those who
Mm,
are doubting whether how long should they prepare and how long should they be into videos and all these. So everything is possible with 1 year preparation.
mm,
And
mm.
how did you really get into MCQ question bank or videos
Yes, sir.
or
Yes, sir.
QRPs
Complete.
and everything else?
Everything, sir. I saw every video. In that, we usually we come across solid malignancies, so it is not difficult for us. But hematological malignancies, I didn't see in my PG career. But after a short read, I saw doc tutorials. First doc tutorials, then a short read, then final revision. Two times I saw videos and I saw every QRP. And I did every question bank, and granters are very good. Actually, they say same what marks I get in granters are same like in this NEET SS exam.
Yeah, so that is where Dr. Real also comes into the picture of the students, wherein we just don't do videos and ask them to read on their own.
Mm,
We get into every other aspect. We get into the WhatsApp groups on discussions almost on a daily basis in terms of questions, clearing doubts, and also encouraging them to read. Then the quick revision programs are there. There are programs of granters. So a multi pronged approach actually makes the students also kind of not in a monotony when they are in the preparation. And
mm.
what is your next and where are you going to be there next? So what is your decision and
I'm
your
I'm planning to go to Hyderabad NIMS, but not sure. After the discussing with seniors, I will take step.
so where do you belong to?
Andhra, sir, Andhra Pradesh.
So you are convinced that you are going to be at NIMS. Well and good. Every institute is going to give you something in terms of medical oncology, and you will take
Thank
a
you.
huge amount of
Mm,
learning from all these institutes and the professors there.
mm,
So all the best. Very happy for you people because it is not just one end that is working. You people pushed so much hard that it's a team effort that everyone gets into all these flourishing results. We are also happy. Thank you so much.
sir, once again, thank you so much, sir. I had all your classes, sir. Yours and Hemant, sir, both sir's classes, sir. Thank you very much, sir, for those classes. For those of hematological malignancies, I can't remember the translocations,
Thank you,
everything.
Karthik.
But after listening, it was easy, sir, for me. Thank you, sir.